The external opening of branchial fistula is present in lower third of neck. A 8-year-old male child complains of severe pain in right testes. The most probable diagnosis is torsion of right testis. Which one of the following statement is not correct regarding gastrochasis? It is ruptured exome flows. Hineke maculis operation is done for pyloric stenosis. 32-year-old female underwent laparoscopic cholecystectomy, which was difficult. On her second post-operative day, she develops jaundice. Her LFT parameter shows serum bilirubin 6.8 mg per deciliter, direct bilirubin 5.6, indirect bilirubin 1.2 mg per deciliter, and serum alkaline phosphatase 1226 international unit per liter. She is most likely suffering from obstructive jaundice due to bile duct injury. A 60-year-old man presents with painless progressive jaundice for 2 months. He has a history of weight loss. On examination, his gallbladder is palpable, which is smooth, non-tender and globular. His serum bilirubin is 18.2 mg per deciliter. He is most likely suffering from carcinoma head of pancreas. A young 23-year-old male riding his motorcycle meets with a road accident. He is tachypneic with heart rate 110 per minute, BP 112 per 74 mmHg. On examination, he has tenderness over left side of the chest with decreased air entry. His trachea is pushed to opposite side. Abdominal examination is unremarkable. Most probably he is suffering from hemothorax. Mondor's disease is thrombophlebitis of superficial veins of breast. Which of the following is not true regarding renal carbuncle? It is a type of renal tuberculosis. Anderson-Hines operation is performed for pelvic ureteric junction obstruction. Which of the following is not correct for strawberry gallbladder? It is a malignant condition of gallbladder. Treatment of choice for recurrent thyrotoxicosis after surgery is radioiodine. All of the following are features of polycystic disease of kidneys except erythrocytosis. Which one of the following is the most important selection criteria for obesity surgery? BMI greater than 40. 45-year-old underwent abdominal rectal prolapse surgery. At present, he complains of sexual dysfunction. This is probably due to the injury of pelvic autonomic nerves. In endoscopic retrograde cholangiopancreatography, endoscope is used as side viewing. Oliguria is defined as less than 300 ml of urine excreted in a day. A 40-year-old man with history of reducible left groin swelling of 2 years comes with severe pain over left groin. Swelling is now non-reducible and is very tender to touch. Most probable treatment plan for this patient would be prepare for emergency surgery. During laparoscopic inguinal hernia repair in the triangle of doom, the following are true except base of iliac vessels. All are rare type of lateral hernia of abdominal wall except obturator. A 35-year-old female had laparoscopic ventral hernia repair using polypropylene mesh in January 2015. In June 2015, she is again admitted with features of subacute intestinal obstruction and is managed conservatively. She continues to have recurrent colicky pain after that. Most probably she is suffering from bowel adhesion to mesh. Which of the following is not correct for breast abscess? Antibiotic is given if pus is already present. Important landmark in submandibular gland dissection, the posterior border of mylohyoid muscles. Important landmark in submandibular gland dissection is the posterior border of mylohyoid muscle. Which of the following is not a feature of systemic inflammatory response syndrome? Bradycardia. 35-year-old man present to emergency with acute onset pain abdomen radiating to whole abdomen and abdominal distension for 1 day. On examination, he has tenderness guarding all over abdomen with pulse rate 100 per minute, BP 116 by 84 mmHg. X-ray chest erect position shows gas under bilateral domes of diaphragm. Probably he is suffering from colonic perforation. A 70-year-old man comes to emergency with pain lower abdomen and not passing urine for 8 hours. He has a past history of urgency, hesitancy and frequency of urine. On examination, he has a lump over the umbilicus, which is slightly tender. What is the next step of management? Perurethral catheterize the patient. Swiss cheese defects of anterior abdominal wall after exploratory laparotomy is best seen while doing laparoscopic ventral hernia repair. A 35-year-old male patient comes to casualty with acute pain abdomen and on examination found to have cold clampy extremities, sunken eyes, dry tongue, thready pulse, drawn and anxious face with abdominal guarding and rigidity. This is clinical picture indicates diffuse late peritonitis. All of the following statements are true for keloids except true keloid does not spread into surrounding tissue. Which of these is a palliative shunt procedure created between the left subclavian artery and pulmonary artery to treat cyanotic congenital heart disease, Belloc-Taussig shunt.